Welcome back to STL Live. I'm Sarah Bernard, and my guest is Dr. Kanika Turner, and we're learning about the opioid epidemic right here in St. Louis, Missouri, and the work that you're doing, which is really neat. You're going out to churches and giving medical presentations, kind of hitting the community right where they are, right where they're already meeting.
Yes.
And you're particularly interested in the African American community and the problems that that you're seeing with substance use disorder.
Correct.
Is that correct?
Correct.
Okay, so when you go in and you're giving presentations in churches, and any church can call you
Correct.
and reach out to you and have you come and present.
Yes.
What are some of the things that you're telling people to be aware of? I would imagine people ask you, what do I look for? What are the signs and symptoms of addiction in my family and friends?
Correct.
What are things they can be aware of?
Right. So some of the things I always educate on is first understanding that addiction is a chronic disease. You know, not looking at this how people used to look at, heroin use, cocaine use, but to understand that it's an actual medical condition. So as a physician, that's how I treat it as such. So getting people to look at this as they do, diabetes management, hypertensive management, the same way as that. So some things I always discuss, how does this affect the brain? Some of the things that people normally see is that behavior of, having to use more and more opioids over time or going through withdrawal, and helping people to understand that long-term use, people are using to feel normal. They're not using to get that high. They're using so they won't get what's called drug sickness. So helping people to understand that over time, it's a chronic disease and it changes into, I just want to feel normal, so that's why I'm using early in the morning. So helping people to understand that paradigm.
That's very interesting, and it's certainly not what we think of when we think of addiction.
Correct.
So do people come up and ask you where to get help? Do you have people who actually are in the throes of addiction who are looking for
Yes,
resources?
they do. I have at probably majority of the presentations, if not all of them, I always have 1 to 2 people come up to me, either themselves or a family member, wanting to know where can I get my family member connected to resources. So here in St. Louis, thankfully we have a lot of treatment centers that's around. Some of the fairly qualified health center, like my clinic, Family Care Health Center, we're also offering treatment as well. Another place is ARCA, Assisted Recovery Centers of America, and all of these treatment resources can be found on the website. And you don't have to have insurance. One good thing, Gateway to Better Health, I don't know if people are familiar with that. They actually started offering benefits to cover substance use disorders through Gateway, which is like a local insurance company. It's not like Medicaid, it's not like private insurance, but it's something better than nothing. So there's coverage for it. So you don't think about the insurance part, just go and present and we'll figure out the money part.
Okay, that's good to know. So have you been able to reach the homeless community yet?
Through some of the churches, they have programs, outreach to homeless communities. I have not been invited directly to like shelters. Well, actually one shelter reached out to me to come and do a presentation, and so we're actually going to get that scheduled probably in May. But a lot of it is through the churches or different organizations that have me out.
And you're working with the state of Missouri. You're working with a grant, right?
Correct.
To do this. So tell us a little bit about that.
Yeah, so the state of Missouri, they receive, it's a federal grant, was $20 million to the state of Missouri to fund efforts regarding opioid use disorder with prevention, treatment, and recovery resources. So my portion is really, really small. It's a faith-based initiative. Those funds, unfortunately, are running out, but we did receive another grant, which is $30 million, and it's the state opioid response. So a lot of my work is paid for through that, so I don't charge for anything that I do.
Yeah, that's fantastic. All right, well, we have to take a break, Dr. Turner, but thank you so much, and please come back and keep us posted on how you're doing and what we can do to help you.
Thank you.
Faith-based opioid awareness in Missouri Opioid STR's initiative is to increase awareness about the resources available to manage the opioid overdose crisis in the Black community. To find out more, contact Dr. Kanika Turner at 314-207-1717 or visit MissouriOpioidsSTR.org. There's more STL Live after this, so please stay with us.